Hello everyone, we're going to start the webinar in just a moment, so please sit tight. We're just going to give everyone a chance to sign on. Hello everyone, my name is Brian Jones and I'm the Membership Manager with AVLS. I'd like to welcome everyone to the AVLS Member Reception presented by AVLS Leadership and sponsored by Medi USA. Before we get started, a few housekeeping items. All attendees are muted so we don't pick up any background noise during the program. The webinar will be recorded and posted on AVLS's website, and a link will be emailed to all who have registered for the event. You'll notice a control panel on the right side of your screen. You can type your question into the screen and it'll be added to a queue. The Q&A portion of the webinar will take place at the very end. Our presenters this evening are Dr. Marlon Scholl, AVLS President, Dr. Christopher Pittman, Board of Directors, Healthcare Policy, Linda Antonucci, Board of Directors, Ultrasonography, Dr. Zoe Deol, Membership Retention Chair, Dr. Cindy S. Bjornson, Membership Recruitment Chair, and Robin Bjork, Lymphatic and Integumentary Rehabilitation Section Co-Chair. I'd like to introduce our AVLS President, Marlon Scholl, who would like to share a few words. Go ahead, Marlon.
Thank you for that introduction, Brian, and welcome everyone. I want to take this time to welcome all new members and established members to this virtual member reception. Of course, this event would not be the same without the support of Medi USA, who has supported this event ever since I can remember. If you're new to our society, welcome. Please take time to meet as many people, and specifically leaders of this society, who are prepared to lend a helping hand or answer questions that you may have. This is one of the big benefits to the in-person new member reception, as it has always given new members an early opportunity to be engaged. If you're an established, long-standing member, welcome and thanks for your commitment to the specialty in our society. This is new for you because the new member reception has always been about new members, but opening this up today for all members is actually an important portion of this day. A virtual meeting may not offer the same personal feel as our in-person meeting, as we all know. And I have to be honest, we had this meeting scheduled in Washington, D.C. merely 2 to 3 weeks before an election. I'm sorry, but that would have been an electric environment and one I would have cherished. I know that's not the best for everyone, so maybe this might be better for some, okay, that prefer that less chaotic environment, if you will, to get our education and our social connections. The planning committee and the AVLS headquarters have gone to great lengths to enable participants to connect with faculty, attendees, and exhibitors in this virtual environment. I would encourage you to stretch and see where the Congress site takes you. Don't be afraid to reach out and ask questions. The lifeblood of this specialty and its society is membership. We have a welcoming society to all persons dedicated to the venous and lymphatic space, no matter your training or background. That's been the case since this society's existence. We're all continuing to learn in this relatively new specialty, and this Congress offers an enormous opportunity to enhance the knowledge base for every participant. Glenn Anderson. Glenn Anderson represents Medi USA and is the Vice President of Product Innovation with Medi. He's a past president of the Foundation for Venous and Lymphatic Disorders and has been active in venous and lymphatic health and the device field for over 20 years. Glenn is based in North Carolina at the headquarters of Medi. A little bit more about Medi USA is that it's a part of Global Medi, a company based in Germany, established over 65 years ago and currently with a presence in over 80 countries worldwide. As I pass the microphone to Glenn Anderson, I ask that you take the time and make the effort to get connected. We've merely touched the surface of what we can do collectively. Thank you and enjoy.
Thank you for that introduction, Dr. Scholl. I appreciate that. First of all, greetings to everybody and welcome to this new format. And I just want to extend a warm welcome to everybody on behalf of Medi. And Medi is honored to be affiliated with the AVLS, and we've always enjoyed our interactions and longstanding relationship over the years. As Dr. Scholl mentioned, I can't recall when we weren't involved with the AVLS. Definitely want to extend a thank you to Dean Bender, John Mangold, Dr. Scholl, and the rest of the leadership team for the strong sense of collaboration that we've enjoyed over those years. Now, I'm sure we've all heard this expression, at the risk of being repetitive. As with all things 2020, this particular event is challenging, with a new way of doing things. As new members, as prospective new members, I hope this format does not dampen your interest. Based on what has transpired in 2020, I believe the AVLS has adapted and continues to be effective for both its members and supporters alike. I know my personal experience with the AVLS can be summed up in some simple terms: advocacy, collaboration, and inclusion. The AVLS always represents its members well, is very open to input and new ideas. And as Dr. Scholl mentioned, by all means, reach out to those leaders, those members, and pick their brains, find out what's going on. And of course, the AVLS always focuses on including all those who want to excel in the venous and lymphatic space, and specifically without a bias towards any one specialty. And I definitely admire that sense of inclusion. So we hope you enjoy this evening's presentations, learn a little bit more about the AVLS, and I will be available through the evening as well for any questions that are specific to Medi or other things related to AVLS. With that, I want to hand it back to Brian.
Thank you very much, Glenn. We really appreciate you being here, especially Medi USA. We're very grateful to have you a part of this special night. Now we're going to turn it over to Cindy Esbjornsen, who's going to talk about membership.
Hi, that's Asbjornsen, but close enough. Just checking, is my mic on here?
Yes.
Okay, great. Okay, sorry about that. Let me jump right in and say, while it may seem that we are firmly entrenched in 2020, we are at the beginning of a new fiscal year for the Society. Despite the year's challenges, COVID in particular, our association maintained its sound structure and organization, retaining more than 1,500 members. Our membership, as well as our leadership, is a diverse group. We are proud to be represented by members in more than 40 countries, with professionals of many different races, ethnicities, ages, and gender. Our membership is also comprised of a multidisciplinary group of more than 20 medical specialties, including physicians, nurses, sonographers, therapists, and allied health professionals. The AVLS membership was seeing steady growth until the COVID-19 pandemic emerged in the United States. Recruitment and retention began to steadily decrease, with the biggest impact happening over this summer. June and July are by far our largest renewal months, with more than 500 memberships up for renewal. We experienced a significant drop-off, nearly 100 members during this time as a result of the pandemic. However, We are confident many of these dropped members will reactivate their membership when normal business resumes. With the emergence of virtual annual Congress, we've experienced a strong increase in new members and member reactivations. While we hope to maintain the momentum we've experienced over the last 2 months, we understand the pandemic will still impact our membership numbers. We look forward to building our membership in 2021 with new organizational membership offerings that incentivize organizations to join as a group and receive additional benefits at significant savings. Members by category. Our membership is made up predominantly of physicians. However, we've maintained a strong base of allied health professionals, including nurses, nurse practitioners, sonographers, therapists, physician assistants, and administrators, among others. International members have maintained a steady base of 10% of membership. Other members include retired physicians, honorary members, residents, and fellows. Our membership is made up of many specialties, including vascular surgery, cardiology, radiology, general surgery, family practice, general practice, dermatology, among others. Our gender and age. While our membership is more than 2/3 male, we've seen an increase in female membership in recent years. Currently at 31%, we credit much of this to the work of our female leadership, especially through the ultrasonography and lymphatic and integumentary rehabilitation specialty sections. Our average member is 54 years old, consistent with many other nonprofit medical specialty societies. Years active. The AVLS is a relatively veteran organization, with the average member being with the AVLS for 9 years, with 1/3 of our membership having been with us for 4 or less years. We have the opportunity to collaborate with fresh minds and perspectives on how we can evolve into the future. Webinar. Even in the year that the presented obstacles are beyond our control, we persevered by launching many exciting new programs and platforms to benefit our members. AVLS introduced a series of free webinars in April and May on practice resources to assist during the COVID-19 pandemic. Topics included best practice for employees, telemedicine, dealing with financial turmoil, marketing strategies, virtual practices, and more. Each webinar hosted an average of more than 100 registrants. We look forward to expanding on new educational topics in 2021. To further engage our member and provide a strong networking outlet, we unveiled the My AVLS Community, MAC. The MAC serves as a messaging board for the AVLS members. Through this platform, members have shared ideas, opinions, insight. This community has increased member engagement, also while allowing groups within the AVLS, such as committees, task forces, and special sections, the opportunity to communicate with each other. VitaDocs. AVLS partnered with VitaDocs.com to help our members reach new patients for vascular and lymphatic system-related symptoms, conditions, and treatment options. This platform enables members to showcase expertise, highlight medical services, and share success stories while establishing credibility, improving online reputation, and attracting new patients, as well as booking new appointments. Organizational membership. In order to build relationships with organizations as well as individuals, AVLS has begun offering institutions the opportunity to join as an organizational member. Through this new category, organizations can have their physicians and allied health staffs join at a discounted rate and receive complimentary live and online educational credits. AVLS has already recruited its first organizational member, Indiana Vein Specialists, a practice that has provided memberships for 10 allied health professionals and 2 physicians. VR Sclero. AVLS introduced its first virtual reality educational offering in May, Immersion Sclerotherapy, VR360. This was a great opportunity for our members to obtain CME credit in the comfort of their own homes. By the end of the fiscal year, we had 25 registrants from whom we have received overwhelmingly positive feedback. We look to build on this success with new topics in 2021. Annual Congress. This year's Annual Congress, October 15th through 18th, will be 100% virtual and will be our first foray into the web-based platform. This will enable registrants to view and navigate all our live sessions as well as access on-demand content. It will provide our audience with easy access to the latest product and service development in our innovative hall and innovative theater.
Thank you so much. I'd like to now turn over the presentation to Dr. Zoe Deol, AVLS Member Retention Chair, who will share her experiences with AVLS.
Hi, can you guys hear me?
Yep.
So, okay. If any of you know me, you know I'm a procrastinator and I didn't make any slides. So I'm just going to talk off the cuff here and tell everybody, introduce myself and tell everybody why I joined AVLS and the reasons I joined. And now looking back after having been asked to do this, reasons that I never even realized that benefits that I got from it. So first of all, I think most of us are, when we trained for our profession, we trained in a residency program, we trained in a fellowship, and it was kind of a natural progression that you knew the doctors around you, you worked with them, you transitioned from your training program into a practice, usually with a group that you trained with or somebody that you knew. So it was almost like a high school, college, medical school progression. When it comes to the vein world, it's a specialty that we all went into as a second specialty, not our primary specialty. So we're already in practice. And how do you get that extra training, that extra knowledge, the mentors, the education that we got when we were training in residency and fellowship? And that was what I was looking for when I transitioned from bariatric surgery to endovenous surgery. And I didn't know where to go. So I looked into the various societies that were out there, and the AVLS to me had the most to gain as far as the three big ones for me, which were learning, teaching, and opportunity. So that was what I loved so much about my training in surgery, was the learning and the teaching. I love to teach, and when I teach, I learn more about my specialty. At AVLS, because of the variety of specialties that belong to the membership here, I knew I was going to learn more than I would ever bargain for by hearing about venous disease from the eyes of a dermatologist or the eyes of a gynecologist or an emergency room physician. This is a unique opportunity that you don't get in any other specialty that I know of personally. So I joined a couple different societies and I went to the meetings, and when I sat in the educational sessions at the AVLS Congress, I realized right away that this was not only a society that I wanted to join, it was a society that I wanted to be a bigger part of. And my goals went from learning and teaching and opportunities to friendship and mentorship and support. So those are the three things that now I focus on. So in addition to just walking around at the meetings now, I got to know the members, and I joined the committees, and I now present my research. And this year is the first year for me that I'm actually going to be a speaker at the conference that I went to so many years ago and admired all those speakers up there. This is going to be my first year to be, well, not up there because I'm going to be back here, but in a sense, I'm going to be up there speaking. So the opportunities that I thought existed, that I thought I would be able to achieve, I'm achieving far beyond that, just from the friendship and the mentorship and the support that I got by going to these meetings and walking up to the front after the conference, introducing myself, and having all of these wonderful people turn around and talk to me and take me under their wing and show me the next step that I needed to take to get to where I wanted to be. So I think that makes the AVLS unique in as far as it's not us and them, it is all of us. So when you are a member, you are not just a member, you are a part of a bigger whole. And that is what I think you will feel not only when you go to the Congress, but when you take that one step forward to raise your hand and ask any of us for help in what you want to do. Do you want to advocate? Do you want to make policy? Do you want to present research? And for the first time, as you heard Dr. Scholl, Marlon Scholl, with our registry, you can do that. You don't have to be at an academic institution. You don't have to have your own statistician. All you need to do is say, I want to be a part of that. And you can help publish papers. You can help change the course of a specialty that is so new that none of us really know the direction that it's going to go. And that's really exciting to me. So I hope that makes a little bit of sense. And I'm available always. And after all my talks, you can always reach out to me, just like you can anybody that you're hearing here today. And just know that we're one big happy family. And that's what makes us, or makes the AVLS special. That's all I have to say.
Zoe, thank you so much. That was absolutely wonderful. Next, we're going to have Dr. Christopher Pittman from our board of directors speak to you on AVLS's work with advocacy.
Thank you, Brian. And let me get my webcam going. I belong to the Zoe Deol camp of, I did not prepare anything in particular. I have some prepared stuff for a week from tonight, from 7 to 9 p.m. I encourage everybody to show up to the AVLS Healthcare Policy, Healthcare Advocacy Committee Symposium, 7 to 9 p.m. a week from tonight. We get a lot of great information. So I thought I'd just kind of share some background. Look, I was honored to be asked to help advocacy at AVLS about 3 years ago. I've had, honestly, a professional career in advocacy, advocating for physicians and patients for nearly 30 years, and cut my teeth basically in mainstream politics. I realized 4 or 5 years into advocacy at the Federation of Medicine, local, state, and national, or AMA activities as a resident fellow, that the real rubber hits the road in the mainstream political arena, which includes not just legislative, but bureaucracies. What I mean by that is your boards of medicine, in Florida, it's the Agency for Healthcare Administration, these kinds of things. So there's actually, it's not just all about legislation, it's also what's going on in the bureaucracy. So anyway, I dedicated my time after 5 years of intense advocacy as a young physician in mainstream politics. And so I'm going to share a few things that I've learned. I'm past president of Florida Medical Association Political Action Committee. Very proud to say that. I started as a very young physician and basically was on that board for over 20 years. And the organization raises about $2.5 million every election cycle. And so we have some clout here in Florida. What I learned really was being in advocacy. And what I've told my 25,000 physician colleagues in Florida really more than once is the following. You know as much about politics as you did about medicine after your first 4 years of medical school, which isn't very much. And I don't mean to say that we aren't constantly exposed to politics, but advocacy and political things are really internship. It's really an internship and a residency. You honestly cannot get very far just watching the news, reading blogs, listening to the radio or listening to other people. You really have to be in it. And that means going to state capitol, hanging out with candidates, being in campaigns, going to campaign and candidate schools, and then honestly, hanging out with political doctors is what I call them, or professional lobbyists and others who make a career. I mean, politics is big, big business. It's very lucrative, and there are people who make entire careers hanging out in your state legislatures and in DC. And if we think as physicians we have a chance against these people without having a political doctor in our corner, at least understanding how those machinations work, we really don't. And so, anyway, you really have to be in it. And so I was thrilled to be asked to help with advocacy because it's with venous and lymphatic medicine, because it's a much more narrow area than the broad umbrella of tort reform, scope of practice expansion, payers, predetermination, pre-authorization, all those messes that we're all very familiar with. So anyway, 3 years ago, we set out to become, within a couple of years actually, the nation's leading advocacy organization for venous and lymphatic medicine. And I think I can confidently say that we reached that goal within 2 years. And it's a bit of a teaser for Wednesday night, where you'll be able to hear many of the successes that your society's been able to bring home. And like most things in business and politics, it's a team sport. No one person accomplishes very, very much. And we have a very strong team. We have a strong team in Stephen Doherty, our fearless leader and chair of healthcare policy. Of course, Marlon Scholl and Vice President-elect Mark Meisner, John Blevia, and Steve Elias and Vineet Mishra, and a whole host of others that serve. Nearly 30 people serve on our healthcare advocacy committee at AVLS, and that's how you get things done, is in a team way. I have a lot of trite sayings and many in politics, and one of them is politics is the only sport where the spectator always loses. If you're not at the table, you're on the menu. So you don't have to like politics, but you better be at the table or involved, or you're really going to get your butt handed to you. So anyway, I am certainly always available by phone and by email, and it's not on the little slide there. But if anybody has any concerns, questions, comments, criticisms about anything AVLS is focused on, not focused on, communication is a big deal. So we're always open to those kinds of things. I think I'll kind of wrap it up by again encouraging everybody to show up a week from today, 7 to 9 p.m. For our advocacy symposium. Last year at the 2019 Congress, our advocacy committee, which again is well over a couple dozen members, sat down and kind of went through the various issues that we felt rise to the top of the list as to where we should focus. Because when it does come to advocacy, we may care about 25 different things, but it's very important to identify 3, maybe 5 of the main issues that we can really spend our time, money, and resources on. And just a little teaser, the things that we came up with a year ago that, again, we're delivering on and we're very anxious to share with everybody is number 1, improving AVLS's voice on payment. And we have some very great things to share on that. Number 2, advocating for AVLM recognition. There's a recent development at the IAC that we're anxious to tell everybody more about. Number 3, creating AVLS clinical guidelines and policies, which the entire board and others are hard at work doing. Number 4, greater impact on payer policies. And again, lots to report on that a week from tonight. And then number 5, preserving patient access to vein care. And part of that would include not just overuse of venous treatment, but certainly underuse, especially when it comes to venous leg ulcers. And Dr. Schull has a fabulous talk about both underuse and overuse that I don't think can be shared enough. So with that, I'm going to kind of sign off and let the next speaker go. Thank you very much for your time and attention.
Thank you very much, Dr. Pittman. Next, we're going to bring back Dr. Cindy Asbjornsen, the AVLS Member Recruitment Chair, who will share her experiences with AVLS.
Hi, thanks for having me back again. I'm actually really happy to share a little bit about my membership experience with you all tonight. This is one of my favorite parts of the meeting, and I think that's because you never know who you'll meet or what role they'll play in your future. Usually this part of the meeting is held in one of the most beautiful parts of wherever the meeting is being hosted. There's always cocktails, and there's a common theme of just welcomeness. So just in case this hasn't been conveyed, I'm going to raise my glass to the new members and I'm going to say welcome with everything we have here. When I first attended my very first meeting way back when, I didn't actually know any doctors who only practiced phlebology. It seemed kind of like a pipe dream for me. And at that meeting, I met people who were just starting out like me. I met people who were seasoned pros. And I saw many people who seemed to just love what they were doing and have a great work-life balance, which I longed for. So I knew immediately I wanted to do this, but I wasn't quite sure how. I didn't really realize the value of meeting the people who I met at that very first meeting until I actually started practicing phlebology exclusively. When a question would come up, I had experts to call. When an unexpected outcome happened, I had someone to bounce ideas off or try to get a higher level understanding of what I might have done differently. The support has been better than anything I ever could have imagined. 10 years ago, I opened my own practice and the academic camaraderie continued. And before I knew it, kind of like Zoe, I felt like I found my place in the organization and I was offering the same support that had been offered to me to other people. So I'm going to encourage every new member who's hearing this right now to jot down the names of people who we might be able to interact with, even, Chris, Zoe, Marlon. Remember these names because you never know, 5 years, 10 years from now, you might say, yeah, that was the first night I heard that person speak, and boy, what a role they played in my life. So write down some numbers, remember some contact information, and keep it. Even if you never reach out, enjoy the security of knowing this entire organization and that specific person are here for you to support you in phlebology. And thanks for letting me speak again. I'll sign off.
Thank you, Cindy. I'd now like to turn this over to Linda Antonucci from our board of directors, who will speak with you on how to engage with AVLS. Linda, don't worry, I see you. I'm going to unmute your microphone. Linda, are you able to unmute your microphone?
Yes, I am.
Great.
I thought maybe my husband called you instead to keep me muted. Okay, so welcome everyone. And I'm going to be very brief, but my goal is to inspire new members to get involved and engage with AVLS. And as we know, there are so many wonderful reasons to join, and I will get to those in a few minutes. But first, I'm going to tell you why I joined the AVLS and what it means to me. So I joined the AVLS back in 2007 to engage with a group of like-minded professionals, but my experience really went much deeper. I found a community akin to a family, and I think you hear that that's a common theme as we're all speaking. So the AVLS is a mix of mentors, students, and peers, and in my 13 years with this organization, I've been blessed to play each role. So since joining, I've been actively involved, lecturing at annual Congress, chairing the ultrasound and RPHS courses, and now I'm honored to be serving on the board. I formed a large network of colleagues and in the phlebology community, which I like to think of as Vaniacs, and I've become very close friends with many. I find it helpful to have access to these colleagues to discuss difficult cases, to get feedback on new ideas, and to offer advice on other work-related issues that are important to both sonographers and providers. So now just some of the benefits of getting involved. Well, obviously we have the AVLS Annual Congress discount. That's a big perk. We have the Phlebology MAC discussion thread and open forum, and we also have many networking opportunities. We have the Phlebology Journal, the Vein magazine. We have access to virtual CMEs. We have excellent textbooks. Many of them are offered at discounted rates. We have access to instructional 3D videos, and coming soon, we will have ultrasound and scanning and procedure videos. We have access to excellent live format courses. You have the AVLM, and RPHS exam review courses. We have the ultrasound review course, the sclerotherapy course, and we have the lymphatics course, which is our latest edition. For physicians, providers, business management, we have coding, reimbursement assistance, and plenty of education. We also have practice management assistance and advice. And then we have advocacy for phlebology practices, as Chris so beautifully explained and gave you a teaser into next week. In addition, there are numerous committees to volunteer for. I began volunteering for the Silent Auction Committee and made a lot of new friends there as well. And lastly, but certainly not least, we have our yearly gala. That is an absolute blast. Everyone has so much fun there, and I'm really sad that we'll be missing it this year. I hope that my experience and some of these benefits would entice you to consider getting more involved, because I believe the AVLS is truly a unique community. And I found through many of the mentors that I had that this is where art and science intersect and lasting friendships are formed. So welcome, and thank you for having me speak.
Thank you, Linda. Lastly, we have Robin Bjork, co-chair of the LIR specialty section, to also speak with you on how to engage with AVLS.
Thank you. Brian, are you able to give me the controls so I can share my screen?
There you go.
Okay, thanks everyone for staying around for this presentation. I'm really excited to meet you. I am a fairly new member to the AVLS, and I come from a little bit different background, and that is lymphedema therapy. So we have a brand new section, a special interest section for the AVLS called the Lymphatic and Integumentary Rehabilitation section. I am the chair, and I'm very excited to tell you about this section. Co-chair is Heather Hetrick. Julie Green is also on the steering committee, as well as Christina Hankins. And I just want to thank these members of the steering committee, because we've just spent this last year trying to work out, you know, who are we? What are we going to do? And it's really exciting for you guys as new members of AVLS to be able to have an opportunity to perhaps join us in this section, because it's a blank slate. We can do whatever we want with this section, and there's so much opportunity. In 2018, AVLS charted a new course. This was when they made the major name change from the American College of Phlebology to American Vein and Lymphatic Society. So we, as you noticed on the steering committee, we're all certified lymphedema therapists, and we're also all certified wound specialists. And we really have not really had a good home to find ourselves under the cover of physician groups, and especially vascular and vein specialists. And so this is new for us. We're trying to find out, how do we fit in? How do we all collaborate together? How do we make vein practices grow and expand lymphedema services so more and more patients can get access to care? So LEAR stands for Lymphatic and Integumentary Rehabilitation, and it's the official name now that, as of this Congress coming up, is going to replace what was called lymphedema section. Who is it for? It's for all members of the AVLS who have an interest in chronic edema or lymphedema, because now we know all edema is lymphedema, lipedema management as well, and the associated skin and wound management that goes along with that, as well as comprehensive rehabilitation. It takes a whole team, and so we're excited to start to have representation of that team in our section. We came up with a definition to explain really what this section is all about. And it says lymphatic and integumentary rehabilitation is designed to comprehensively and holistically address patient management issues, associated complications, and contributing factors that lead to lymphatic, integumentary, and functional impairments related to lymphedema. So this is a broad scope of what this affects. Lymphatic pathophysiology requires a team approach to maximize patient outcomes and requires knowledge and appreciation of the interrelationship of the body systems for prehabilitation, rehabilitation, restoration, and maintenance to improve quality of life. So that's kind of a mouthful. Lymphatic medicine is really an exciting area of clinical practice, because it really we've had a blind eye to it, and it's been neglected for so many years. And we are having an explosion, really literally, in research and the scope of lymphatic medicine. And I really think that AVLS can be a leader in this field. There are so many new imaging technologies and assessment tools that are being used in other countries that we would love to see come to the US. And it really fits in with vein assessment and vein practices. Just like you do an assessment of the whole vein system, you would do this same imaging of lymphatic vasculature through lymphofluoroscopy, ICG fluoroscopy, where we can actually see, the therapist could actually see where things are flowing and how we can partner to help improve lymphatic drainage and also improve people's response and ability to have vein procedures as well as functional outcomes with those procedures. So this is kind of our launch, all right? So just want to invite anyone that has any interest at all to get involved. And we want to build memberships and communications in the My AVLS MAC LEAR community. And I'll show you how to access that. We have an AVLS lymphedema or LEAR section meeting coming up that is venal lymphatic trivia and a collaborative approach to treating phlebo lymphedema. This is October 13th from 7 to 9 p.m. and that's sponsored by Tactile Medical. Want to thank Medi for sponsoring this event tonight. And we are going to have special projects. So one special project we identified was maybe coming up with a lymphedema treatment protocol for phlebo lymphedema. So that would be a good project. We'll kick it off after we have everybody kind of tied into this community. If you are not already an AVLS member, just simply go to the AVLS member website, go to the website, and then you can just click on Join AVLS, download the application, and when you fill out the application, you can join the special interest section, lymphatic and integumentary rehabilitation. If you are already a member, all you got to do is go to the MAC community and click on MAC Connect with Members, and then you can search under communities for special interest group to join LEAR. So I just want to thank you for your time and hearing about this section. I hope my video was still on. So I hope to see you guys through this virtual conference, and even more so in the future where we can actually connect in person.
Robin, thank you so much. We would now like to open up the program to your questions. We'll do our best to answer as many as possible. You can see on the screen here the question option. Just plug in there and hit enter.
Hey, can our panelists all share their webcams and we can field questions?
Okay, question number one. If I'm looking to eventually serve on the board of directors, where do you suggest I begin in terms of volunteerism?
Brian, do we have the ability to answer those questions with video on? Because I think it would be more impactful.
Yes, absolutely. Oh, you mean to ask the questions with video on?
No, to answer them, sir.
Yeah, please go ahead. Yeah.
I might be able to take a stab at that one.
Yeah, I can't, for some reason, I can't see.
I've got everyone's webcam up right now.
Perfect, I'm so sorry, I had the wrong screen. Guys, I think I'm good at tech, but I'm really not, so I apologize. Yeah, Chris, before you take a stab, because I'm sure you can take a stab, but it all comes down to service, in my opinion. If you want to get engaged in this society, there's plenty of opportunities to do it. And being involved in the society for 16 years as I have, it really involved getting engaged. And the more that you're involved in committees and things of that nature, my goodness, doors open up, opportunities arise, and you can basically grow within the society. And next thing you know, maybe get that invitation.
Next question, how can I become a speaker at the next annual Congress?
One second, Brian. Chris, you wanted to take a stab. Do you want to add something to that?
I was just gonna say, I remember minding my own business, going to a meeting about 10 or 12 years ago, and actually Marlon Schull was talking about something, and I went to ask him something and say, hey, maybe we can do this. And he said, go talk to that guy, he's gonna be the president. And that kind of got things started. And I started volunteering on the silent auction committee. I'm not sure even how that started, but I bumbled into it. So there's plenty of opportunities to become involved. The more you get involved, the more you're going to be asked to be involved.
And there's so many ridiculous opportunities. It doesn't matter. But the point is, without participation, you can't expect to, you got to participate. Okay, we're all in this together. Okay, so the more we work together, and we've got such an active membership right now, the more we work together as active members, the more we can accomplish together.
I think a good way to do that is through committee participation. I think that's one of the first steps is find a committee that you're passionate about, and that will get you through the door to all of those other things that you just asked about.
Next question was, how can I become a speaker at the next annual conference?
I can say that everybody has something important to share, and you have an interesting case, make a poster. Posters are a great way to sort of get a foot in the door. Make a poster, you have a 5-minute speaking block, and see how it goes. And if it goes well, then let it grow. But original research is always appreciated.
Spot on, spot on. If you've got a busy practice, you got an interesting topic, and you've got, okay, let's look at just basic research. Okay, if you get 30 participants in each group, you may find statistical meaning. That doesn't come to a power study, but if you're trying to study a benefit of X versus Y or study something, even 60 patients, 30 in each group with substantial follow-up is probably a reasonable abstract. So if you've got a research topic and you want to submit a formal abstract, my goodness, you want to talk about a quick way to the stage and recognition, that's the way to go.
Zoe, this next question is for you. What is the dog's name?
The dog is Luigi, and this is my Halloween boo-boo kitty. And Luigi, come here.
So precious.
Yeah, Luigi is special because he's only got 3 legs. So say hi, Luigi. There you go.
Next question. I am currently in a residency program. Is there enough for me for annual Congress to attend?
Can I take this one? My first Congress, I was a resident, and it was a deciding directional pivotal moment for me. So just come. It's so worth it. And yes, there's more than enough for you at the Congress. Plus, and plus. You'll learn things that you'll just be blown away. Just come. Also, I believe, and someone else might know more about this, maybe Dean, that we have some funding available for interns and residents. So look into all of the options in terms of how you can get yourself here.
Yes, if I could just add on, conference, the annual Congress for residents and fellows is actually complimentary. We just need a letter from your program director confirming you're in a residency or fellowship program. So we definitely invite you to come to and take part in it and take advantage of that offer. Yeah, this is a very good question. My practice has struggled during the pandemic. Can you each let me know what one good reason would be to renew my membership during this time?
I can answer that, and I think everybody else probably can add their 2 cents, but for the support, basically, to understand how to make it through the pandemic and what we're doing together in sharing our ideas and in approaching through Chris, as he'll talk to you through the advocacy to ensure that the Medicare cuts that are on the shelf are not going to affect us, and there's strength in numbers. So if you want to affect that change and want to ensure the security of the field, joining now is more important than it was before the pandemic.
And if I may, Linda, do you want to share what we did when the pandemic broke and we were working to provide evidence-based guidance to our entire membership?
Yeah, we provided protocols, so many things. I can't remember exactly all of them, Marlon, but we did a lot of research, and early on when this was brand new, hot off the press, we were out there and we were creating safety protocols and best practices for each of you. So I think that we certainly have the pulse on what's going on, and we do our best to get that information out to you in a really timely manner.
Thank you, Linda. Chris, please.
Wow, to put it in context, I've raised a lot of money that you can't deduct for political purposes, and you really get those kinds of questions. Look, when it gets tough like this, that's when you got to come together. We really did produce an enormous amount of resources, not just how to run a safe office, but really how to stay afloat. And if you go to the website, you'll see just an overwhelming amount of information on loans and so on and so forth. But I'll kind of conclude with this, with the business hat on. Business people pay the most for their advice, namely their accountant and their attorney, and they nickel and dime everything else. So if you're going to nickel and dime, wow, don't nickel and dime your advice and your resources for information. That's not a place to nickel and dime. That's the shortest way I can say that. Thank you.
Robin, you want to say anything?
I'm just listening and absorbing all of it. Thank you.
Zoe?
Yeah, no, not other than what I just said, but yeah, I agree with everybody. And again, strength in numbers.
If you're in the venous and lymphatic space and you're not a member of our society, I think you're missing out. We've got the best education, we've got the best support. We are looked to by other societies to lead in these spaces. And so we are the leaders in venous and lymphatic medicine. And if you think there's another place to go, I'm sorry, but visit them, find out if they can provide the support that we do. We are the place to be. We are the place to, that's it. We do it. And everybody's looking to us to lead, and we do it.
Marlon, I guess I would add that, lymphatic medicine is just expanding so rapidly, and this is a great opportunity. AVLS has taken the initiative to figure out how can we expand practices, right? How can we partner together to have better services for people with lymphedema? How can we get them diagnosed? And this ultimately will help expand practices. So if you're looking for an organization to help you grow versus just trying to stay afloat, think about the new vision. Think about expanding your practice. Right now, I have an education institute for lymphatics, and we've gone to teletraining. I can tell you more people are reaching out now for lymphatic education training than ever before. And there's more patients now that need help and diagnoses and medical care and procedures because they were never recognized before. And right now there's a catalyst of celebrities all over the US. There's government influence. There's just so much more awareness of lymphedema, and it's just coming out of the woodwork. So these patients are going to be advocates for themselves and try to find the practitioners that know what they're doing. And I think AVLS is well positioned for that. And so that's just one option that I can speak to of expanding clinical practice and finding new revenue streams.
Cindy, do you have anything to add?
Sure. I mean, I can add two things. First, those webinars, with guidelines and everything were invaluable. I really, really appreciated that the AVLS was right there giving advice and helping us be safe and be smart. The second thing I want to add is, when all of this happened, it was new to everyone. And as a solo practitioner, I turned to my AVLS colleagues to say, hey, what are you doing? And how are you going to make it through this? And a lot of private conversations about how to weather this storm happened. And I thank the AVLS for providing those people on so many different levels to just give advice and to just help bat ideas around and to just help each individual figure out what the right next steps were, how to navigate the loans and the monies that were available and how to make smart choices in a completely new paradigm. So I feel like it was invaluable to be part of this organization during that crazy time that continues on.
Thanks, Cindy.
Next question, is the MAC the best way to get opinions and advice about difficult or special cases?
Great question. The MAC is growing. I get an email every morning for every new thread, and everybody on this panel has been involved in different threads for the MAC. Who would like to lead with this question?
I'll just say it's a great idea. I haven't used it for tricky cases yet, but sure. I know it has been amazing for other things. I recently had an equipment issue and I posted it, and instantly I had great resources, references, and volunteers to just help me out, which was really very kind. So I think it would be a great place to post a tricky case, or if you have a question.
And AVLS is keenly aware, and everybody should be integrated into new comments on cases and things. So I believe you would get pretty quick feedback. It's designed so that we get that feedback. Additionally, as there's new interest groups, you know, it will have more sections, I believe. We didn't want to start with a grandiose communicating platform, and so the idea was to let's see what people have as interests. And so whether it's advocacy, interesting cases, lymphedema care, ultrasound, or others, I mean, yeah, we've got space and everything to I think communicate effectively. Linda, I know you've been on a number of these MAC, I don't know what you call them.
I don't know either. Yeah, it's a great place to have a conversation and get feedback instantaneously. You know, you put a question out there or concern, and within minutes sometimes you have this response, and it's just great. And then you see this back and forth, and then you see other opinions, and you know, it's just a wonderful resource. I love it. I think it's good, very good. I read it every day as well.
Just a reminder to the audience members, the MAC is the My AVLS Community.
Yeah, it's a great place for cases. Great place. Bring them on.
Great place. Yeah. Bring it.
There's your answer.
Any other questions? Okay. Looks like that'll just about do it. Let's see. Well, I'd like to, this brings our reception to a close, and I'd like to thank all of our speakers and our sponsor, Medi USA, and also you, the members, for taking the time this evening to learn more about AVLS and your membership. Just a reminder, there's still time to register for the AVLS 34th Annual Congress on October 15th to the 18th. Dr. Margaret Mann and her planning committee have created an outstanding virtual program covering deep and superficial venous disease, lymphedema, wound care, vascular medicine, and venous ultrasound. You can claim up to 25.5 live CME hours and 80.75 CME for enduring material. You can learn more and register at www.avlscongress.org.
Thanks, Brian.
Thank you, Brian.
Yes, that's an incredible amount of CME. Thank you, panel, for participating, and thank you, everybody, for attending tonight.
Thank you. Good night.
Thank you very much.
Bye-bye.
Bye-bye.